Alright, so today we're going to be using the new LiNA OperåScope. We're going to use it to take out an IUD. And this is just a brief picture of the setup. This isn't actually sterile, but I'll show you what we do. So, Denise, just right over here. So we've got an IV pole. You've got saline with an IV tubing. You can do it under pressure, but we found we don't have to do that. So all you need is the inflow, and then we'll use this as an outflow to gravity. Okay? So that's fine. And we usually put it in a can when we do outflow in a plastic bag. Now, the table, basically all you're going to need is a couple of things. You're going to need you basically need a couple of things. You'll need some scopettes, some betadine, a speculum, some dilators. You really don't have to go much above this dilator because the diameter of the OperåScope is really skinny. So a couple of dilators, and if they're not nulliparous, you can usually enter the uterus without dilating at all. And then we have our graspers. These are the graspers from the stores unit, and they're very narrow at the end. We found that the Olympus graspers did not fit down there. We have a grasper and we have a scissors in case you need to cut out a polyp. We're going to be retrieving an IUD. Now the OperåScope is very simple. This is all sterile. Everything is sterile. It comes with a screen unattached like this. You just basically take it out of the package like this. You close the screen, like so. You go ahead and slide in the battery pack, boom, and the light comes on. And now you've got an amazing picture right at the end here. You can adjust the light. It comes on maximum when you turn it on, and you can lower it down. You can take a video, take a picture, and here's your operative channel. You can adjust your screen like so, and the picture's just gorgeous. Now, we want to look at it on a bigger screen or record it, and the patient wants to see it. This is all sterile. We'll pass this off. Okay? And my assistant will, of course, plug this in. We'll do it here today because it's not sterile right now. We'll be doing the procedure in a little while. We'll plug it in. Now, the USB port's right here for your recording. You can store it. And now you can see, show up on the screen here, Denise, what it looks like. And so this is what it looks like inside. So the patient watches that. I'm watching it on the screen. It's a beautiful picture on the screen. I'm going to show up there, Denise. And the patient can watch. You can record videos. And then we'll hook up the water. It's real easy to do. Of course, this is sterile at the time. We have an inflow here. And don't look down with that. Just hook it in like it's there. Okay. Mm-hmm. All right, so now we have an inflow here, and the outflow is just passive, and the arrows tell you exactly where to do it. Of course, you flush it through so that you basically, you can just show it flushing through, Denise. Now I'll open the valve here because you don't want air in there. Perfect, look at that, nice flow. And we found that you don't need to put pressure on it right now. It's a very, very fast flow. Okay, so then you're doing your hysteroscopy going up inside the cervix. And to see, we did an embedded IUD, so you basically slide the grasper down, and it comes out the other end. You got it? Mm-hmm. And there it is. And so you can do that with the water flowing. And now you take it out. You can use the scissors down through there. And then when you're done, you just basically pop out the battery. Your screen is flat. Take off the suction. Close off your water. Pull off the water. Throw this away. You're done. And that's it. Nothing to sterilize except for the graspers. You can buy them reusable also and throw them away, but we're not going to do that. And that's it. Then you got your film. Patient's happy. And you can turn directions by turning this little button here. And that's it. Thanks. Okay, so we're taking out an IUD. We're using the new LiNA OperåScope. You can come over and take a look at it right here. Good. So we're using the new LiNA OperåScope, and it's brand new. We're the first ones in New York to use it. And so we're taking out an IUD that's embedded. The strings are up inside. So what we'll do is we minimal dilation, and we have water running in, just pure saline, and we have a great picture, and there's a cervix, and that's beautiful. And so what I'll do is I'll take a little grasper just from the Batoki scope, and we slide the grasper right down, right here, just like this, and it goes right in, perfect. The patient's tolerating the procedure really well. We grab the strings, perfect, we can see it, and pull it all the way out. And then we have ourselves an IUD. That's great. Okay, thanks.